My name's Scott Acord, and today's date is April 4th, 2022.
My name is Laura Reyes, and I am the Patient Experience Senior Program Manager for Providence Medical Foundation. I have been in a patient experience role for the last 16 years.
How important is patient experience?
It's all about how do we ease the way for our patients? How do we take away the fears, the worries, the things that we can eliminate from their experience when they go to a hospital or a clinic visit? There are so many tiny little details that can make or break an experience for a patient. It could be something as simple as the way that somebody greets you when you walk in the door, that someone smiles at you when you feel a little scared, that people explain the care.
I would assume that it could go the other way too. Maybe a caregiver is having a bad day and maybe they just did something, even if it's small, might really disrupt a patient experience.
Absolutely. It could be something as simple as not lifting up your head when a patient walks in the door because you're busy, maybe keyboarding something, and then the person that's in front of you feels like you don't have time for them. Not maintaining eye contact, not checking in to let someone know that the wait's going to be longer than maybe you expected. Before I joined healthcare, I used to be a hairstylist. I was not in any way associated with anything related to patient experience. The only thing I knew about patients and hospitals was that's a place you go for care. In this particular time, my father had not been feeling well. He thought he had a bad flu, and he actually went and got seen at urgent care, and they thought that maybe he had a flu. And they sent him home after that urgent visit. He experienced a massive stroke while at home. In fact, that morning, my father was going to take my youngest sister to Disneyland. And my youngest sister at the time was only 6 years old. And my little sister was trying to wake my dad up because she was excited about going to Disneyland. And my dad was just able to lift a finger or an arm up, but he couldn't talk. Of course, my little sister did not know that my dad had just suffered a massive stroke and my father couldn't talk anymore. My older sister showed up and discovered my father halfway off the bed and knew something was awfully wrong. And she called the ambulance and they transported him to an ICU. When we went to go see my father, my mom was still at work. This was during a time when there wasn't any cell phones yet. This was in the late 80s. We all ended up going to the hospital, the 5 siblings. I'm the oldest of 5, and so we were all at the hospital trying to find a way to get a hold of my mom. While I was there, the doctor pulled me aside and asked me, are you the oldest of the family? And I said, yes. And he goes, well, we need to talk to you. There's a very urgent situation. And so he pulled me and my sister into a room, put the x-rays up on this board and said, your father suffered a very serious, massive stroke. We're going to do everything we can to keep him with us, but it is very touch and go. And we were like astounded at that outcome because my father was 57. He was still relatively a young man. Later on, my mother shows up. So for the next 3 days, my father was in the ICU. His sisters were brought in from Mexico. All of a sudden, there was about 20 people in the ICU lobby for a couple of days. I witnessed some very tender moments with my siblings going into the room and talking to my dad, singing to my dad, even though the nurses said, we don't think he can hear you. But for us, it was like, well, if there's any chance that my father could hear our voices. And so we talked about our love for him. I remember seeing my brother just tenderly put a blanket up to his neck to make sure he was warm. And he started talking to him about the days that they would play baseball and just all those things that you want to say to someone when you don't know if you're going to see them again. On Christmas Eve at 2:30 in the morning, the nurse rushes into the lobby and says, wake up everybody, your father is slowing down. That was her way of telling us that my dad was about to pass away. They graciously allowed all of us to go into the room. We surrounded him, his sisters, his kids, his wife. We saw my father peacefully pass away. It is now Christmas morning. We started to pipe in the very soft Christmas music throughout the hospital. They were giving away these ornaments to all the patients that were being discharged. It was a nativity scene. And I remember this one nurse, she wanted to talk to us. So she said, can I talk to the two of you? Me as the oldest, my mom is now the widow, right, of my dad. She hugged us and she said she was so sorry that this happened. And then she said something that really surprised me. She said, it's Christmas morning. I can't even imagine what you're all feeling. But I don't think that your dad, and then she looked at my mom, your husband, would want Christmas to now be something of sadness. It's a very special day. She told us, take comfort in the fact that your father, your husband, passed away on one of the holiest days of the year. And then she handed my mom the nativity scene, the ornament that they were giving all of the other patients. She says, hold on to each other, take care of each other, you have each other, and know that your father would want you to have Christmas still be special. My mom and I looked at her and we hugged her. We all cried together. What a beautiful thing to say to us. I never forgot that nurse, that compassion. And my mom and I sometimes even talk about it. Remember that nurse and what she said? And my mom said again, the little ornament, which I still have.